The governor absolutely begging anyone he can to get the shot if possible. He says not only will it save lives, it will also save our economy.
It's something to take serious.
Across southern Nevada,
This isn't fake news.
Governor Sisolak preaching
It's not something that's been fabricated.
and pleading
It's the truth.
for Nevadans to do one thing.
Protect our entire economy and get the vaccine.
Speaking today to reporters alongside U.S. Health and Human Services Secretary Xavier Becerra.
If you get the vaccine, it'll save you, it'll save your life, it'll save your family's heartache, it'll save our economy.
Becerra echoing his concerns.
Failure is not an option. Failure means people die.
The data paints a clear picture. Surged by the Delta variant, doctors say Nevada is seeing an uptick in COVID cases, hospitalizations, and deaths. Las Vegas is also categorized as a sustained COVID hotspot by the White House, a concern we brought up directly to the governor after the third Vax Nevada Days drawing.
The Delta variant is serious. I mean, there's no doubt about it.
But says it's a concern his team is working directly to combat.
If there's two people gathered on a corner, I'm going to stop and talk to them about getting the vaccine. We're going to do everything we possibly can.
Along with several statewide pop-up clinics and efforts, a federal government surge team came here to Las Vegas, going door to door to coax people to get their shots. The governor hoping it will all be enough.
Hopefully we don't have to look back. We can continue to look forward because our economy cannot take another hit.
Good evening, everybody. From what Las Vegas hopes is the secret weapon to get more people vaccinated. We're at a pop-up vaccine clinic at Sherman Gardens in the heart of downtown Las Vegas, in the middle of a community that needs more convincing vaccines work. It's not easy, but it's worth it, says County Commissioner William McCurdy.
Well, I just had an opportunity to go knock a few doors, and based on those conversations that I had over there, they said, all right, we're going to look at the information and we may stop by.
The vaccine push that was once so easy is now a door-to-door skirmish to fight a virus that does not want to give up. It's why, here at Sherman Gardens, the governor, along with the Secretary of Health and Human Services, stopped by. The federal government has sent what's called a surge team to Nevada to help the state stop its recent surge in COVID cases. 900 more since yesterday. The federal surge helps pay and produce flyers like these that go on doors around the valley, explaining and coaxing people to get their shots. Earlier, at a briefing at the Fire Department Training Center.
We were thrilled to be able to support Nevada in opening more than 50 COVID vaccination sites, including more than 20 here in the Las Vegas metropolitan area.
That's FEMA's Dave Bibo, spelling out what the federal help has meant. And the help is needed, says Secretary Becerra.
This is now a pandemic of the unvaccinated.
The math of this pandemic is important. In Clark County, the state says 56% 12 and older have initiated vaccines. Only 46% have finished. Both numbers need to get higher, officials say. And the sad snapshot right now is this, says the governor.
The vast majority of those in hospitals right now, well over 90%, with COVID, all have one thing in common. They're not vaccinated.
In Las Vegas, Jeff Gillen, News 3.
Yeah, Jim and Marie, the illness still baffling doctors on its connection to COVID-19 is called multi-system inflammatory syndrome in children, or MIS-C, and it's hospitalizing kids and babies right here at home.
High fevers that are more than 48 hours, and they have, vomiting, diarrhea, abdominal pain. They may or may not have a rash. They feel very tired. Their heart rate increases.
The CDC defining multi-system inflammatory syndrome in children, or MIS-C, as a rare but serious condition associated with COVID-19 in which different parts of the body become inflamed, including the organs.
It affects your heart, your lungs, the kidney, even the skin, the brain. GI symptoms in particular with liver failure. And we've seen children with thrombosis.
Doctors say other MIS-C symptoms include headaches, enlarged lymph nodes, red eyes and swollen lips, hands, feet, or even the tongue.
As the world starts to open up, we also know that the cases of COVID are still continuing to climb.
While much is still unknown about kids and COVID, we do know that coronavirus cases in children are on the rise.
It's a Delta variant. It's very contagious, aggressive, and we're seeing it in kids between 3 and 12 years of age. But we're also seeing it in infants, which is a little bit different than the alpha variant of the COVID.
The added concern now, more COVID cases may lead to an increase in Miss C, and right here in Southern Nevada.
We've had several cases at Sunrise and UMC. There are some children that could be in the ICU for 3 weeks, 3 to 4 weeks.
Hi everybody, I'm Reed Cowan from News 3 Las Vegas. We want to thank you for checking out our YouTube channel. Remember, you can always see more of our videos by clicking on the video links. And also don't forget to click that subscribe button so that you don't miss out on any of our YouTube updates. Thanks for watching.